The other reason methylene blue, I think, helps people feel better is it's a mild MAO inhibitor, which means really for serotonin, but also dopamine, you're going to make those neurotransmitters a little bit more efficient, which helps to boost how someone feels, not only cognitively, but just mood-wise. And then you throw in the element that methylene blue acts as an antiviral agent, probably across, not just viruses, but, bacteria, parasites, I'm sure. And so you have this very powerful compound. That one compound does all of these things: energy production, helps with mood, helps as an anti-pathogen agent.
Welcome back to the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host, Jodi Duval. In this episode, I have the privilege of diving into the world of performance medicine with Dr. Craig Koniver. With over 22 years of experience in the field, Dr. Koniver has earned a reputation as a health and human performance specialist, focusing on nutrient and science-driven protocols for performance and longevity. Dr. Koniver has not only overseen more NAD+ and peptide therapies than any other physician in the world, but also counts Fortune 100 CEOs, professional athletes, A-list Hollywood actors, and Special Forces servicemen among his many clients. His remarkable career has been devoted to redefining health and performance through cutting-edge protocols, and he's known for creating the patent-pending Fast Vitamin IV and re-engineering NAD+ IV protocols, now called Brain Refuel. In this episode, we explore a wide range of topics from nutrient evaluation to stem cells, hormones, the key tools it takes to feel good, and the medicines and therapies he recommends for optimal health and performance. Without further ado, Dr. Craig Koniver. Welcome, Dr. Craig Koniver. Thank you so much for coming on to the Smarter Not Harder podcast, and I'm absolutely honoured to be interviewing you today.
Oh, thank you, Jodi. Thank you so much for inviting me. I'm truly honored to be able to speak to you too.
Yeah, pleasure. So now, Dr. Craig, you have an incredible practice, and you have been going for a very, very long time in this. One of my favourite topics is performance medicine, and I really want to dive into that with you today. And there's so many different aspects that you do within your practice, which is across the country and across the world now. So really my fascination is how did you get into performance medicine, and maybe a little bit of behind that.
Yeah, I mean, I don't have a great story. I opened my practice here in Charleston, South Carolina, here in the States in 2006. And for whatever reason, I don't remember at the time, I got involved with nutritional IVs. So I'm family medicine trained, but I set up a, primary care practice here, but I also started doing these IVs. And at the time, this was not popular. There was no hydration, no, hangover IVs. It wasn't big like it was today. There was not even a lot of bioidentical hormone work that we do today. And even functional medicine was just starting to get somewhat popular. And so I was fortunate that I got to learn a lot about how these nutritional IVs worked, really about bioavailability and nutrients and absorption. And from there, it's just evolved in many different directions. And why I like the term performance medicine is I don't necessarily totally align with the functional medicine approach, which for many functional medicine providers is really allopathic in nature, which is, you're going to treat a symptom with a pharmaceutical, and functional medicine does a lot of that just using supplements, but the mindset and the approach, the paradigm's the same. For me, it's not just about helping people feel their best, it's helping them perform their best. We can't slow down aging, right? I mean, I know people say they want to live to 120, 180. That's well and good, but if you can't perform whatever you want to be doing, then does it really matter? So it's certainly quality over quantity. So, we've been fortunate. We get to work with over the years, just from even just the longevity of it. We oversee probably more NAD treatments and peptide treatments than anywhere else in the world. And that's just because we've had the experience and, again, the longevity. So it's evolved over time for sure.
And the IVs themselves have just taken off across the world. I remember it was not long ago that I was in London first hearing about this, maybe 5 years ago. And then now there is so many different companies, even here in Perth, which that says a lot for it, because Perth is very far away from everywhere. is now well known. Yeah.
Sure. Yeah, no, it's been interesting. It's been interesting to kind of be a part of that, from the outside at first, and then really being on the inside of this arena, and then very privileged to help shape how we talk about it, how we use these tools, and our philosophy here, which I'm sure you're aligned with, is it's very much about direct experience. We really like people to try things. I don't, as much as I'm good at this and I understand things from my perspective, the only way for a patient to truly know if something's going to work for them or not is to try it. And so we pride ourselves in really that direct experience. We study things, we try things. We like to consider ourselves the beta testers, making sure it's safe, making sure there's some degree of efficacy. But in terms of how individuals come into this realm and understand and waking up, they really has to be through direct experience. And that's what we get excited about for sure, is kind of helping shepherd and kind of walking this walk with our clients and helping them through this process of watching them kind of get it, that light bulb moment of they're like, oh my goodness, truly anything is possible. And it's just really an exciting time.
Absolutely. I totally agree with you in that. And even back to your point before about functional medicine, and we're still treating the symptoms. I work in a creative clinic that has lots of shiny new things. Sometimes you have to actually push the edges a little bit to get somewhere, and that's what I really love about you, is that you're not afraid to actually push the edges slightly to actually get better results for your clients, for patients, for anyone who is following along and learning from you as well. It's an incredible experience to be able to move with the trends, but also have success around those, and also be backed by so much incredible science and the efficacy, like you said. So, I think there is so much new coming forth as well. There is so much more exciting new things coming, but we also have to make sure that it's, rooted and grounded in this sort of the foundational approach. And I think that's where you really shine, as well as making sure that there's that lifestyle medicine component, there's that foundational support, there's that, like you say, walking through with clients so they're actually fully aware and fully a part of their own health. And that's what is missing, that care factor, I think, with a lot of the allopathic medicine. Yeah.
I agree. Yeah, we term it here. This is how we look at it. We it's really choose your own adventure, right? So our philosophically, it's about sovereignty, which is choice, empowerment, which means it's your own, and then exploration, which is the adventure of it. And I think there's a lot of great people doing a lot of great work, but a lot of it, especially if you are in this arena, feels very heavy, and feels very, almost like if you don't do it a certain way, you can't do it well. And I just don't align with that, right? I think everyone is going to have to figure it out for themselves. And for a lot of people, that doesn't resonate, right? Because we're a society now that in many ways is obedient, wants to be told what to do, wants to be told like, okay, you need to be on cholesterol lowering drugs and you need to take these vaccines. And if you don't do all this and take this chemotherapy, then you're not going to be healthy. And that creates so much fear within people. And it's true, I think, in many ways, that the diagnosis is the disease. And so we like to attract the clientele that's ready to, do best for themselves. And that's just kind of how we want to push it out to the world as well. I think that's the only way we learn. And that's the only way we can experience not just life, but health and every aspect of it, which makes it, not only really meaningful, but also fun. Like, it doesn't have to be all serious, right? Like, we don't have to, like, if you just watch Instagram and think, okay, how am I going to learn to be healthy? You have to do all these high intensity workouts. You have to fast all the time. You're having to do sauna and cold plunge and all these things every day just to keep up. Well, who can do all that, right? I mean, that's really challenging. And the stress of that, I think, is we don't talk about that enough, but that stress accumulates over the course of our lifetime. And then people just having this notion that they can't do enough is very, impactful as well.
Yeah, absolutely. I follow the likes and Ben Greenfield, and for many, listen to all the amazing things he does, but it's a lot. He's trying and doing, and he's in it, and it's his job to be able to experience and actually tell stories about all of that. But it can also seem very overwhelming, especially those who cannot afford it or cannot access it, because multiple parts of the world can't actually access some of the things that he's doing. Yeah, so
basics, and you can teach that so easily with clients. We pull back all of the boxes that they put in with the allopathic medicine, and a lot of it, their conditions aren't even explained, or they put in the wrong boxes for a particular reason, and they don't have to stay there. And it's explanation and empowerment that then leads these clients into an ability to make their own decisions about their own health and actually find out new options. Yeah.
Yeah, I mean, I was trained in the allopathic medicine world, and it's, and I don't fault physicians who still, and providers who still kind of practice that way, right? I don't think I know that some people would say, oh, they're just in it to boast and promote the pharmaceuticals, but that's just not how their mind thinks. It's not their paradigm, right? And so they're trained that when they're seeing a patient, they're thinking of remedies, which 99% of them are going to be in the box of pharmaceuticals. That's all they know. Right. And so I don't fault them for that. But I think that, and actually, I think that most people in today kind of need that structure and need that guidance for their own self, whatever we want to call that. But what we do, what you do, what I do, what plenty of others of us are interested in is providing options for people who want to go beyond that, who are curious about, and if we look at the history, which I've studied of, particularly here in the States, of how medicine and the healthcare system is set up, it was a very deliberate effort back, in the early 1900s to do away with all of the valid, other modalities of chiropractic, acupuncture, nutrition, fitness, hydrotherapy, all of these things that we now say are woo-woo or quackery. That doesn't, involve some double-blind placebo-controlled study that a pharmaceutical company does. And we talk about this a lot here, is particularly in the States, people define their health by the medicines they're on, right? And that's a problem, right? Like if you look at what, ultimately is the downfall of people is probably their mindset and believing that this pill is going to be the panacea of their health, which is never designed to be. It's a major problem.
It's huge. And the amount that people are on, I'm blown away daily by the lists that come through or even emailed to me. What? It's crazy. Absolutely
Right.
crazy. Yeah.
And so I love for people to just figure out the path for themselves, right? And so we just want to provide options for people. We're going to do it in a safe way. We're never going to recommend something that we haven't tried, that we don't try on a lot of people. We are clinicians first. We're interested in clinical results. I don't want to wait for the academics to tell me 20 years later that this is, that I need permission to do this, right? Because what we're talking about are safe things like nutrients given through an IV, peptides, bioidentical hormones, nutrients themselves that we take orally, right? That people debate, oh, should you be taking a vitamin? Well, we can debate left and right about how our food supply is toxic and how it's very challenging to get all your nutrients from food, right? And if we just totally just dismiss that and say that's not possible, we're missing a large part of the conversation.
Absolutely. And, back to the options that you provide people. Yeah. There are so many, and obviously IV is one of the major ones that I want to discuss with you, but there's, sure, ketamine, peptides, there's hormones, and I would love to dive into those and your options, obviously. And I was reading today, because you've just had your peptide protocols come back on, and
right.
Peptides, dabbled in a little bit, but we can't get them very easily here in Australia. So it's
right.
To have what you have created here, and I'm very jealous all the time. I'm like, if only I live this.
Okay. We're working on it.
Yeah, please try hard.
Sure.
So let's talk about IVs. So nutrient IVs, and we'll start sort of that foundational level, and we can add all the shiny bits on top. So the basis of nutrient IVs. Now, obviously people ask me this a lot, how do I know I need it? Why are you recommending this for me? How do I know if I don't need it? And what is the risks involved in me taking this or having this? And then, could there be an outcome that's not ideal? So they're my first.
Yeah. So the way I learned was just by observation, right? And so we still do, and we used to do a lot of nutrient testing, and this is certainly not perfect, but this is just a good starting point. So when people ask the question, how do I know if I need it? Well, I know, right? I just know that the vast majority of people can't get all of their nutrient needs from the food they eat, nor can they get them from supplements they take. So if we look at just math, for example, we say that on average, you're only absorbing about 20% of your nutrients orally. Okay, so whether that's food or whether that's taking a nutrient, so 20% is a very low number. Whereas if we look at intravenous, it's closer to 100% absorption 100% of the time, right? And so that just is how it works. And we know that because even in the conventional medical world, things that are injected or infused, whether they be chemotherapy, vaccines, even vitamin B12 shots, we know that there's a higher degree of absorption, right? Antibiotics, what I tell people is community-acquired pneumonia here in the States, still in the top 10 leading causes of death, maybe fifth or sixth. Most people, probably 2/3 or more, can do well with outpatient antibiotics, but there's still a third to a quarter that need to go into the hospital. Why? For intravenous antibiotics, so they get the absorption of those antibiotics, which can get into the bacteria and halt the bacterial growth. So I think people understand that. And so then people are saying, well, how can you test for everything to see exactly what I need? No, because the testing is not as dynamic as our own biology and physiology. So it can be a starting point. And we do sometimes start that way with patients, but a lot of it is going back to, let's see how you feel, right? So let's try something. And so we do a lot of intravenous NAD, the vitamin B3 derivative, the chemical cousin of niacin, which is the substrate of what our mitochondria uses, the battery of our cells, that takes the fuel that we consume, right, fats, carbohydrates, and proteins, and turns it into chemical energy, ATP. And NAD seems to be, for a lot of people, the rate-limiting nutrient or substrate that we need. So we tell people, from observation of doing this a long time, about 8 years now, treating thousands upon thousands of people, we're seeing transformational experiences where people are, up-leveling and accelerating their health at a pace that I haven't seen another therapy. So in terms of need, I'm not sure if you need it, but I can tell you that for the vast majority, like 95% of people who do it, they love it. And they report back a higher quality of life, more energy, their sleep quality is improved, their mood is better, languaging is easier, looking at colors are brighter. So many facets of their life becomes easier because we're taking their nervous system and kind of switching it back on. And so from there, that's what we start with a lot of our patients, is we want them to try and experience something like NAD. And from there, once they, again, like we talked about initially, kind of understand what's possible, because anything's possible, then they're interested in, like, okay, what else can I do? And then there's a whole host of other IV therapy, from just simple vitamins to high-dose vitamin C to ozone therapy to using tools like intravenous curcumin or piracetam or olive leaf extract to methylene blue. And then it's just figuring out for each patient what works best.
Exactly, it is. Yeah, that fascinates me that you're using herbs and also things like piracetam as well. It's incredible.
Yeah, we're fortunate. Go ahead.
Yeah, because I've taken piracetam for my cognitive performance, but I've never had an IV. So would there be much of a difference?
There is. So the typical oral dose of piracetam, by the way, is a racetam class of medicine. There's a whole host of them. It started with piracetam, all the way goes up to something called levetiracetam, which in the States is a pharmaceutical brand named Keppra, which is anti-seizure medicine. And what these racetam drugs do is they help some of our neurotransmitters kind of operate more efficiently, primarily acetylcholine. And the reason we call them nootropics or smart drugs is because acetylcholine is used for learning and studying. And so when you take piracetam or any of the racetams, you're going to help your acetylcholine operate more efficiently. So a typical oral dose of piracetam is about 2,000 to 2,500 milligrams. When we do it intravenously, we're giving 12,000 milligrams intravenously. And it happens over about 3 to 5 minutes because it's a very small volume we're able to infuse in. And most people comment they feel like they've been plugged into an electrical socket in a good way. It's like the light bulbs have just immediately turned on. And so it is different than the oral dose. And we use a lot of piracetam just because of that effect, right? Like, a lot of people struggle not just with fatigue. That's probably the number one complaint, but it's not just physical fatigue. It's cognitive fatigue, right? Not being able to perform, have memory recall, being sharp. Piracetam goes a long way in helping that. It's really interesting.
I might have to try that when I come and visit you in a month or so.
For sure.
It's something that recall for a lot of people, memory fog, recall, fatigue, it's huge. So I think anything cognitive benefit, when we've got a hyperbaric in our clinic, and that helps a little bit, just to be able to get some of that movement cognitively. Even on a one-off session, I'll hop in there and try and do some work just to get my brain restarted.
Sure.
Yeah, that's fascinating. So I want to ask about methylene blue, because I haven't had or seen a lot about the IV methylene blue. So what sort of things are you treating with the methylene blue?
Lots of things. Methylene blue, I learned about it during COVID. So it's been about 3 years or so. I was hearing a lot about it on podcasts, and then eventually met a doctor who was telling me, this is at the early stages of COVID, how he was eradicating COVID quickly by the use of methylene blue, which fascinated me. And so I started researching and diving in, and learned, actually, interestingly enough, methylene blue here in the States was the original pharmaceutical prescription. It was the first one ever prescribed. And traditionally it's used for carbon monoxide poisoning. So people will get methylene blue intravenously to help remove the carbon monoxide molecule and displace it with oxygen on the red blood cell. And then, from further research, what's really interesting, well, there's lots of aspects, but methylene blue does a couple things that are interesting. One, we talked about NAD, and NAD works on the mitochondria. There's, not to complicate things, but just to give an overview and certainly a simplification for people. The way we really make energy is something called oxidative phosphorylation, where we are exchanging electrons for protons through these different hubs or cytochromes on the mitochondrial membrane. Cytochrome 1 is where we need NAD. And then cytochrome 4, which we call cytochrome C oxidase, is where methylene blue binds. Now, they're similar molecules in that both are electron acceptors, but they work at different parts of that electron transport chain. Again, the analogy I use is a big traffic jam. Right. In a big traffic jam, we just can't get energy to flow. And when we give people NAD on the first hub, we're just opening the traffic jam, which is, again, to free up electrons to move across that gradient. So electrons and protons can move to eventually electrons move down these different hubs so that we can turn something called the ATPase to make ATP, or chemical energy. And why I think just postulating why so many people respond to NAD is because it's that first hub that seems to have the traffic jam.
Yeah.
Well, methylene blue doesn't work on the first hub. It works on the cytochrome C oxidase, which is essentially the fourth hub. And so there's some people who the first hub is not the issue, right? And that's just what we've seen clinically. Like, some people will do NAD and they don't have this, like, oh my goodness, I'm feeling better, my nervous system's turned back on. They don't really feel an effect. I think I can say 100% of those people have responded to methylene blue. Maybe what we postulate is the traffic jam is taking place on a hub, one of these cytochromes that's further down the chain. And so that's why we give people methylene blue. And again, just like NAD opens up the traffic flow, you can start moving electrons to make more ATP. The other reason methylene blue, I think, helps people feel better is it's a mild MAO inhibitor, which means really for serotonin, but also dopamine, you're going to make those neurotransmitters a little bit more efficient, which helps to boost how someone feels. Not only cognitively, but just mood-wise. And then you throw in the element that methylene blue acts as an antiviral agent, probably across, not just viruses, but, bacteria, parasites, I'm sure. And so you have this very powerful compound. That one compound does all of these things: energy production, helps with mood, helps as an anti-pathogen agent. What's different about methylene blue versus NAD, though, NAD is not absorbed well orally, and methylene blue is. So while we give it here intravenously, we also use a lot of it orally, because you can take quite large dosages orally and really get a really bang out of it. Yeah, it's a very powerful nutrient and very safe.
Yeah, it turned my attention as well, fascination, through COVID, because there came out so much more information on that, quercetin as well, or quercetin, however anyone says it, but all these things really drove forces with COVID in ways to actually come up against anything that people obviously were experiencing and really kickstart them. As you can see, I've used a little bit of it tonight to get my energy centers back up.
Yeah.
At the 9 o'clock time, and I'll still sleep, hopefully. But with so I have seen some footage of when you're actually having the IV methylene blue. Do you go tinge of blue for?
No, I don't know if that happens, but what will happen is Yeah, what will happen is your urine should turn a tinge of green or blue, depending on how much you get into your system. And it's actually interesting because if your urine doesn't turn green or blue, and it doesn't happen right away, but it'll usually happen a couple of hours after, whether you take it orally or intravenously or put on your tongue. If your urine's not turning blue or green, that should last almost 24 hours. To us, it signifies that you really need it, right? So there should be some spillover of that methylene blue into your bloodstream that's not picked up inside your cells, that gets left in your bloodstream to then get, filtered by your kidneys, makes its way into your bladder. So we've had some patients who they've used methylene blue even intravenously, and their urine doesn't change. And those people we've ramped up. And once we did that, it's just a neat kind of, clinical sign to see. Once we've done that, they start feeling much better. So it's a good marker actually to use.
I had wondered that actually, and I'm glad you brought that up because that's one question I hadn't written down, but always sit there and go, why some days is my urine when I have been using oral yellow and some days not? I mean, it's blue and some days not. Yeah.
Yeah. Yeah. And so I think it's when it's not, you have a higher need for it. You're just holding on to more of it. Yeah.
Yeah. Fascinating how you talk about the cytochrome as well, because obviously I look at different stacking techniques that I can do for people to add on, so sometimes we'll do red light, which has a little bit more of that cytochrome 4 activity, and then I stack on a bit of methylene blue, and then boom, pop them into the hyperbaric, and then I hope for the best.
Yeah. No, I think that's the way to do it. I think, and it's not only stacking nutrients, but it's also stacking therapies, like you said. So using energy devices at the same time or in serial sequence with using IVs or peptides or nutrients, whatever it is, I think that's the way forward. That's what, we do a lot of stacking of nutrients one after another serially. Like, so we'll do, a very common one is NAD, methylene blue, piracetam. And that really kind of fires people's nervous systems up. If we had a we'd go right to that, just like you do, because I mean, that would be a powerful, powerful combination. Yeah.
Yeah. And sometimes, and you obviously, this is what I want to ask you later on, but you see clients that are so desperate, they're so sick, and they're almost begging you to get better. So, time and time again, you see patients like this, and you just really want to do the utmost. You're like, what else can I add to this? What else can I do to really push this person in the right direction? And it's really good because then it's driving all these different ideas.
Well, and that's kind of philosophically how we look at it, right? So in traditional medicine, we're trained to get the diagnosis first, right? Like they say, if you don't have the diagnosis, you can't aptly treat the patient. I don't know if that's true, but what I've learned is I want to help the patient feel better first. Before we get the diagnosis, I just want people to feel better. And it has to do with, one, I want them to feel better, but two, that builds trust and rapport in our relationship. And that's what we use these tools for. Like there's going to be a myriad number of tools. There's always going to be the new shiny tool to use. But our, purpose really with working with our clients is to be on this path and build that relationship with them, because there's going to be ups and downs, right? Life is a big waveform happening, and just understanding that. And we just want to be able to be here with them. And because we live in such a stressful time, they're getting input, particularly social media, from so many opinions. Most of them, I think, are inaccurate. It's hard for people to trust providers and doctors and say, okay, let's move forward. Particularly what we've seen with the whole pandemic and COVID and so much, mistrust and distrust and lots of crazy things happening. I get it that it's hard for people to want to open up and really be vulnerable. And so what I found is these tools like the IVs, they help people feel better fast. When you help people feel better fast, they start to believe in the therapies. And that's where then they can keep taking those steps to want to better themselves. Because that's the paternalistic model of medicine, which is so antiquated, which is the provider knows best and just do what your doctor says. I just don't subscribe to it all, right? Because how can I know what's best for someone? I want to help shepherd and guide them through testing things and experience, but ultimately it's up to them.
Yeah. And it's almost like that. Obviously you give them the window into feeling better, to actually how it might feel to feel better, and how they were feeling was not normal. And it's almost like an opening, and then that allows better higher function for them to make those decisions. And I try to explain people is that I think this is where you need to be, but to get there, you actually need to feel better first to actually make those decisions to get better.
Totally. That's well said. And I think it's an energy aspect, right? I think most people are stuck. They're in a rut. They don't know how to take care of themselves. And a lot of them, have a lot of self-neglect just from the programming that takes place in our society that kind of keeps people in this place. So a lot of it's unlearning. Well, it seems to be, from our perspective, if we can give people some energy, then they can have energy to make better decisions and have more insight about what they want for themselves. And that's where the magic happens, so to speak.
Absolutely. So following on from these IVs, obviously there's a lot that you include in them. There's amino acids, there's vitamins, there's minerals, there's obviously the other things that we talked about, the herbs and the paracetams. Do you, and ozone, which I've not tried an IV, there's also light that I've seen before. So what are your opinions on light IV? And there's multiple spectrums, I believe. I've been to some clinics that have been doing this before.
Sure. Yeah, we have a, for lack of a better term, just a laser that shines light, right? And it uses a fiber optic cable that is really a fiber optic catheter. So it goes inside the vein, and then we hook up different, wavelengths of light. And we've used red, infrared, you can use yellow, green, you can also use ultraviolet. And we know that light, and I think people can appreciate, light is a nutrient. And it may be the most powerful of all nutrients, right? And so using light, the way we do it, lots of different ways to do it, but the way we do it two ways. One, we have the intravenous light, and then we also have a watch that shines light on the pulse points, because the way we found is some of the IVs we want to use light at the same time. So for example, methylene blue is activated by red light, 660 nanometers. So because we find that running the light in the IV, the liquid at the same time doesn't work as well. We'll run the methylene blue and then use the watch and have red light on the pulse points, right? Curcumin, for example, is activated by blue light, right? And they just have a little bit different flavor. Green light seems to be, for the mitochondria, and activating yellow light seems to help with the nervous system. And then you can pair it, like you're saying, with different compounds and the lights in literally, infinity ways to help people. And what we like to do is just let people try it. Again, everyone's a little bit different. I know for me, I personally like the green light the most. I find that the most activating. The other wavelengths of light, I don't really feel as much, and some people it's blue light and some people it's red light. And so again, it's just that exploration and something that's super, super safe. And it makes sense when you then go back and study the biochemistry and understand, and if you're open to it and saying, oh my goodness, light is super powerful, and how do we kind of harness the power of light in a very directed fashion? And that's what you're getting at, and that's what we try to do here. Yeah.
And I love the way that light is coming into science now. I think it's beautiful.
It is. Yeah. It is. I mean, and I do believe, I know people will say, what is the downfall of society? It's all the horrible food we're eating, right? But I tend to believe more that people are getting not enough natural sunlight. Like, I think that's more of a powerful motivator of our physiology and biochemistry than actually nutrients. And so we are a society that's sedentary, all artificial light, all electricity inside. We don't get outside. We don't spend time with nature. And I tell people, most people don't take me up on it, for someone who's really sick, and if you really want to get them well quickly, have them go live in nature without their cell phone for just a couple of days, and they will get better very faster than almost anything. Faster than any therapy that I could give them is just being in nature, right? But most people are like, oh no, I don't have time for that. I get it, but that's a very powerful tool.
Yeah, they also don't have time to be sick, so you got to make a choice at some point, don't you?
Yeah.
Light for me, and I tell my clients, so I'm like, well, you need to get some more light, like lay outside and sunbathe naked, safely. You can get the sun on your body, and then you feel better. You feel amazing. You're detoxing. You're feeling like full of light. You're moving. You're getting blood flowing, and you're outdoors. There's nothing better than that. And they look at me like I'm just so weird sometimes.
I know those looks, but it's also like, it's very practical, like even just hormonally, right? So, just in very simple terms, like cortisol, or stress hormone, is just like the sun. It rises in the morning and sets in the evening. And we we see a lot of problems, and again, I don't think it's talked about enough, is we should be catabolic during the day, which is cortisol dominated, right? And that is wear and tear, getting stuff done. But we really need to be anabolic, which is mending, healing, rejuvenating tissue at nighttime. And those processes have to be in sync. And I just tell people in primitive times, you had to do the most when the sun came up. You had to find your shelter, find food, you had to take care of yourself. But as the day went on, you didn't have to have as much energy reserve. So by the time the sun set, you could then release the anabolic hormones, testosterone, melatonin, growth hormone, to repair your tissue. Because guess what? You have to do it all over again. And so a lot of disruptions happen because people don't get up with the sun. But then at nighttime, when the sun goes down, they take out their phones, or they're watching Netflix, or they're activating their cells, triggering their cortisol release. Well, that has a direct effect on how much anabolic hormones they can release. And so then they don't get quality sleep. And then everyone knows, right? If you don't get any quality sleep or over a period of time, you're not going to feel good. And this just becomes a vicious cycle that people can't get out of. The way out of it, truly, I mean, the simplest way, and it probably is too simple for people to even realize is true, is just live with the sun. Get up when the sun rises, go to bed when the sun sets. Even though that gets you off some sort of rhythm of society, it is the rhythm of life that we're not honoring.
Yeah, and that's so beautifully said, Craig. And I'm so thrilled that you have said that, because I think it does need to be pushed out so much more and talked about so much more. Because really, we need a reset to what we're actually meant to be living like with the circadian clocks. It's all science. Fashion Panda says it. It's been studied to the nth degree of each cell and each clock in each organ, and why are we not living that way? We're just piling on supplements, and we're piling on hormones, and we're piling on medicines, and then expecting all of that to work, but then ignoring the actual simplicity of freedom of actually just realigning ourselves with nature. So
That's super well said. Yep. Very important. Yeah.
Absolutely. And that's medicine, really, at the end. It's like, we can do so much on all of these levels, even if it is still foundational at herbal or nutrient or IVs. But really, we have to have that lifestyle medicine, and that's what that is.
Yeah, and what I tell people, and I know you agree with this, is you can never outwit nature, right? Like God created something so harmonious and beautiful and perfect that we, as much as intelligent and as smart as we're becoming or have become, we will never win that game, nor should we try. But I think people feel pressured from a convenience, and they don't understand the timing's not right for them. That's ultimately what we need to get back to. That is it. That is the answer. Like you said, that's the medicine.
Yeah, absolutely. And I think that, that's a fitting more for the end of the podcast, but I think that's a really good mid segue. But I do want to move back into, how we can help people get back to that level.
Sure.
So with peptides, because peptides, as I said, are a bit of a fascination of mine, just because they're, again, new and shiny in a way for us here. But I wanted to talk to you about how you're administering those. Obviously, I know you have, and normally when I've done them, it would be in a subcutaneous method. But do you add any into these?
We do some peptides IV, but the majority of the benefits of peptides are going to come from subcutaneous injection, just because of the pharmacokinetics, right? Because of how long injecting a peptide in your tissue, in your skin, is going to last versus IV. Now, a lot of the peptides are totally safe to use IV, and we'll use them. I think the most versatile peptide we use is BPC 157, body protection compound. Potently anti-inflammatory, seemingly no ceiling. We can use very large dosages. We use it IV in the setting if someone comes in, they've injured their knee, hurt their shoulder, they're worn out, a lot of inflammation. We can give some BPC 157 to kind of be a spark and help, and it does. It kind of helps people feel better. But ultimately, then we're going to start them on some subcutaneous BPC at the same time, which they're going to do anywhere from once or twice a day. And that's where we see over time the most benefits. The peptide, the class of peptides we don't ever use intravenously would be the growth hormone releasing peptides, things like ipamorelin and GHRP6 and hexarelin and testosterone. We just, those are not appropriate for us to use intravenously. but we'll use all kinds for BPC, thymosin alpha-1, GHK copper, MOTS-C, humanin, cerebrolacin, all these peptides, Cmax, we do use them intravenously. Yeah.
Fascinating. So obviously there's a lot of questions out there on the peptides and tumors and, issues or contraindications and, using alongside hormones and all of those sorts of things. So what's your perspective on that? I see them as relatively safe, but I haven't experienced it day in, day out with clients.
I think they are super safe. I mean, literally super safe. And just by definition, so people are clear, a peptide is just chains of amino acids. So these are all naturally occurring molecules that we put together in some novel combinations. By definition, a peptide is if it's a chain of amino acids that's 40 amino acids in length or less, we call it a peptide. If it's 41 amino acids in length or more, we call it a protein. And so because they're small molecules, they really combine receptors and target the receptors really efficiently. Because they're small molecules, same thinking is we really don't see side effects. The one peptide that does stand out that causes some side effects is what's known as the fat-burning peptide tesamorelin, which is a growth hormone-releasing peptide, where about 30-40% of people, they do the injection under their skin and they'll get a histamine reaction, red, itchy kind of rash, self-limiting, doesn't proceed to anything worse, but it's annoying for some people. And so some people, that's not a good fit, but as for most people, as they use it, that reaction goes away. Other than that, I mean, peptides are so safe. I mean, it's very, very hard to find any sort of clinical negative response whatsoever. And that's why we really like, again, that safety profile, but then we also like how well they work. And, I tell most people, if you're injecting something into your body, you should feel something by the third or fourth week of doing that. And for most people, that's very true with peptides. So, there's things that, particularly in the functional medicine world that are certainly appropriate, like making sure vitamin D levels are okay, right? Making sure you're getting certain nutrients. But for most people, they don't feel that. They don't feel different if your vitamin D is 30 or 70. You just don't. But when you start using a peptide or a series of peptides together, people really feel it. And when they feel it, what happens from a mindset perspective, which is great, if you're injecting something into your body, most people will then be cognizant or more aware, wanting to, work on other facets of their health, whether it be sleep or fitness or nutrition, whatever it is, because we've helped them understand that, again, we want you to feel better. And then when it clicks for them, they want more of that too. So that's why I like peptides. Super safe. People can do it at home, and we're going to see results pretty quickly.
Yeah, and just like the IVs, you're actually making people feel better and notice the results safely, and also increasing levels of health versus possibly declining health levels with other medicines that they could possibly be taking. So sure. It's a good win. With the peptides, so would there be anything that you're testing for in terms of going back to this sort of growth hormone? Are we looking at testing for tumor markers, or are we looking at doing regular scans or anything like that if you're on the long protocol?
We don't. So again, we've tested this over the years, but I think there's a misconception, like particularly with growth hormone releasing peptides. If we use 5 different growth hormone releasing peptides, and what those do is you inject them, they travel up to part of your pituitary in your brain, and they help trigger the release of growth hormone. That growth hormone enters the bloodstream, which then travels to your liver, and then you make this compound called insulin-like growth factor 1 or IGF-1. That's then secreted from the liver, travels all around your body, binds to receptor cells, muscles, and that's where you get the anabolic healing, rejuvenating effect. And I think some people thought, well, if we're using growth hormone releasing peptides, whether it be ipamorelin, which is probably the most common, that we're going to see a rise in that IGF-1. We found that not to be true. I think these growth hormone releasing peptides makes the IGF-1 more efficient, but I don't like to use labs to either get a baseline and look for how well it's working, right? We're going to look clinically. And I know, and for a lot of the therapies we do, we're measuring and monitoring clinically. And for a lot of people, that's not going to be good enough. They say, I need the black and white to know it's working. Well, to me, the black and white is being in touch with yourself and understanding how you're feeling. That to me is the best marker we can use. And it's hard because I get it. We live in a world where people are like, I need the lab data. We just found with peptides, there's not lab data. I mean, we do routine lab testing, but we don't think it's required. These are so safe. There's some contraindications. We certainly don't use them in, for example, in children who are younger than 18. We don't use them in pregnant women. We don't use them in any active cancer. beyond that, it's hard to find a hard contraindication for using peptides. Yeah.
That's really good.
So,
yes, benefits from BPC, skin, psoriasis, gut, joints, anything healing, huge injuries, torn tendons, all sorts has been, and combination treatment, obviously, with other things. It's just incredible. So I feel BPC is very well known as well now.
Yeah, and so BPC is super versatile, like very anti-inflammatory. We can use it subcutaneous. We can use it orally. We use it topically. We use it intravenously. Lots of ways to use it and getting really, really good results. And so the whole kind of paradigm is we want to use things that are safe, but also effective. And then a common question that comes up for people is, which I understand because of this whole pharmaceutical model, is, well, if I start it, does it mean I have to stay on it? Am I going to be dependent on it? That's a really common question. And it doesn't work that way, right? We have people who use peptides and have been using peptides for years, but it's not a dependency. It's a choice. Right? And that's why for us, we really want to empower people to be sovereign over the choices they make, right? And if it's not working for you, just be honest and saying, I don't feel it. I don't notice a difference. Okay, well, then maybe it's time to take a break or stop that one. We really want you to feel these things. There has to be some positive benefit. I'm not interested in people just taking things just because or just in the background, right? Again, we talked about things like vitamin D. There's good data that, having a higher level of vitamin D seems to be protective for your immune system, against cancer, all kinds of things. But there's very few things that are like that, right? People just taking things just because is more of the norm. And if you look at pharmaceuticals, most of them were never designed to be forever, right? Most were not. But the pharmaceutical industry has done a great job in, promoting fear that, oh, if you come off this medicine, something horrible will happen and you need to take it the rest of your life. And so then people get stuck. And we quite commonly do with that with people, things like SSRIs, Prozac, Lexapro, Zoloft, medicines like that. People are like, I've been on it for 15 years. Okay, do you still need it? Like, I have no idea. I have no idea what it's doing for me. But it's hard because most doctors will be like, yeah, you have to stay on it, like stay on it forever. And it's that type of thinking and that fear then bleeds over to them trying things like peptides and being like, oh my gosh, I'm going to be on it forever. No, you don't have to be on it forever. Like, let's use it for a specific purpose and you can come off. You can always go back to it, but it's just a tool in the toolbox.
Yeah. And it's relearning again. It's changing people's perceptions. And it's also, showing them that they have then the empowerment to move. It's health optimization. So you're optimizing certain parts of your health when you choose. So I think that's a really, really good point. Now, back a little bit more on light, but on a few maybe not so fond peptides in the media. One mainly is melanotan. So melanotan 2. In terms of what you see that usage as, and I know it has some usage for libido and erectile dysfunction. It does, I've tried a little bit, and it does make you quite nauseous when you do take even this tiniest. But your perspective on that?
Yeah, I mean, melanotan's a great, to your point, it's a great peptide, particularly for the immune system, right? So melanotan seems to stimulate melanocyte-stimulating hormone, MSH. And some people would argue just biochemically that MSH seems to be the master kind of hormone for even our immune system. And so a lot of people with, mold toxicity or things of that nature can benefit from using something from like melanotan to stimulate MSH and get benefits to their immune system. But as a result, when you stimulate MSH, you're also going to make more melanin and you're going to turn the skin color. Now, a derivative of melanotan is this peptide called PT-141, which is touted as like the libido peptide. But to your point, it has a very small therapeutic window. So a lot of people get nauseous just from small usages. And it can still turn the skin kind of the same color as melanotan, which is this kind of orangey kind of, it's very distinctive color. Some people it works well and they like it. It makes them look more tan, but a lot of people it's this kind of orangey color. I think some of it's just sensitivity or how much people are using. And so with PT-141, we don't use a lot of it because of those two things, right? It has a very small therapeutic window. People get nauseous. And then two, it causes that skin discoloration. People are just not liking that. Melanotan though, that can work, I think, is more broad outside of just libido because of what it's doing for the immune system, energy levels, and it's really fortifying, if that makes sense.
Interesting. It probably is a source issue, and probably you're getting not what you're actually ordering, particularly here in Australia. So I would say that could be a possible issue when we're looking at certain symptoms from whether it was melanotan or whether it was the other one that you mentioned. Yeah, really
PT.
interesting. Yeah.
Yeah.
So the other one, obviously, copper's used a lot in skin products, in external. That a little bit. I did use that. That was a bit of a surprise when I started using that one subcutaneously. But absorption level on the skin versus in the
I think, to your point, I mean, we use it topically, intravenously, subcutaneously. It's one of our favorite peptides for sure. It also has kind of a longevity effect. It repairs DNA. So there's a lot that goes into GHK-C, or copper. It has this really nice blue looking color, which is the copper. And copper is an interesting, element, because copper, when we go back to the mitochondria, copper is needed as part of that fifth cytochrome. And that fifth cytochrome is where we're turning that ATP ACE to make ATP. And a lot of people, probably most people, are more copper deficient than they realize. And there's this interplay between iron and copper. And if people are looking for more information, Morley Robbins, the root cause protocol, is kind of the guru on this. I've learned a lot from Morley. But there's this, we think of, people have too much iron. I'm sorry, people have too little iron. In fact, they probably have too much, which is probably a result of too little copper. So we found using GHK copper is a great way to get copper stores back. But then there's also tons of other benefits for skin, wound healing, the effect on the skin, the collagen. We use it intravenously. People love it. It's very anti-inflammatory. There's a glow to the skin. We can use quite big dosages. We use it sub-Q. We use it when people are trying to heal from something. We use it in long COVID, things like that, or people coming off COVID, because it's very anti-inflammatory. So I really like copper. My wife runs the aesthetics part of the practice. We use it a lot topically there after laser procedures, things that help the skin heal faster. So we're big fans of copper peptide for sure.
Amazing. There's so many options. Now, one before we get off the topic of IVs, and I want to move into protocols with you and timing, is that absorption rates and timing. Differences in do you do every day? How long do you feel the effects? Because these are all common questions that people ask around IVs. Glutathione, I know glutathione doesn't stay in the body for very long comparatively to others, but there are forms of glutathione that do stay around a little bit longer. So maybe just some perspectives on that.
Yeah, I mean, we use a lot of glutathione intravenously for sure. I think as a general statement with IVs, they're not going to hang around the system very long. Most you're going to get 3 to 7 days out of, not much longer. Does that mean you have to do all these IVs every single week? No, that is impractical for anyone. I don't know anyone who's doing that. We do, with NAD, we do it differently. We program, and essentially we do a loading dose, 5 treatments in 10 days. And most people do well with once a month treatment. And that seems to hang around a little bit longer. But other IVs, it's 3 to 7 days, I think, including glutathione. The problem with glutathione is orally, we don't absorb much of it. It's made by our liver, kind of our master antioxidant. People say it helps with phase 2 liver detoxification, which has to do with things like methylation, glucuronidation, using glutathione to help with phase 2. But it's a challenge. I know there's liposomal glutathione that people can use that can work well. But orally, it's not going to work as well. It's hard. I mean, it's this is why I want, people to try stuff, right? And so our philosophy is, if we try something and it's working, then we kind of figure out the frequency based on that. I don't like to program it per se, because everyone's a little different. Some people will do great with glutathione once a month, and some people, they're coming in every week because they really like the effects of it. The only way to know is to try, right? And so the starting point for us is with all of these IV therapies is, let's try it. even if you do it a couple times and get a sense of what it does for you. If you're not, like for me, glutathione, I don't notice much from it. Like I just don't, I've tried it several times. I couldn't tell you, so I don't do a lot of it. Now, could I benefit from it? Maybe, but I'm going to listen to my kind of internal system and trust that I don't really need it. Right. And so that's what I want people to do, is trust their radar about things. And, and then we'll have people who say, just come in once a quarter, whatever it is. And I just trust that more than anything. But the only way to do that is to try. We do have some general thoughts. Most IVs, again, 3 to 7 days, you're not going to get much more out of that, if that helps.
Yeah, that's good. Yeah, I love it. It's really person-led medicine. It's really, your knowledge, they're leading, they're feeling, and it's really just leading them in the right direction. And they can decide then, and you create safety around that, which is awesome.
Yeah. Yes, exactly.
Yeah. So, all right. So protocols, and maybe dive into, I know we're going to run out of time soon, but dive into a little bit more on the sports, because we actually haven't covered sports performance yet. Yeah. And I know a lot of those are locked down and, tight regulations and not able to do this and not able to do that. So it is really hard. And I do know that obviously Fast OV that you've got is an amazing company, I think. Am I right to say that?
It's not separate. It's not separate. It's just an IV that we do. Yeah.
Yeah. Yep. So very well known though, and spreading across America and even the rest of the world where it can be. But you're obviously enabling people to do these sorts of things at home, but also you've got the Fast IV. I've never done one. I've never been brave enough. I feel like I'm already a little bit needle phobic, so looking at it and pushing it in myself would be tricky. But talk me through the different protocols and options you have. So you said the IV, the bags, the Fast IV, the peptide protocols, and how that looks also on the sports front.
Yeah, I mean, we're fortunate. We treat athletes of all levels, from amateurs, weekend warriors, all the way up to the world's best professional athletes, and it's great being a part of those worlds and those arenas, and seeing kind of the discipline and mindset that it takes to kind of be next level. But what I've learned is that these athletes, even at the highest levels, are engaging in some of these tools. Right? We do have whatever organizations like the World Anti-Doping Agency, which sets pretty strict limits on what people can use. And most of the peptides, even going back to just last year, January 2022, for example, BPC was added to the list of banned substances. So most of the peptides are not allowed to be used. And so, what we counsel the athletes on is, here's the list, and here's how long it'll stay in your system. For example, most peptides, if people are using them in the off season, they're going to get off by at least 3 weeks. They're going to have a time period of at least 3 weeks before they potentially could get tested. And that seems to work well. There's IV regulations. You're not allowed to use more than 100 cc's of any fluid every 12 hours without something called a therapeutic use exemption, which is very challenging to get. And so we just want to make it clear there's certainly lots of options, but we have to kind of stay within the boundaries of sport. Obviously, some athletes are more conscious of that, and some athletes are less. I think from a just bigger picture, these tools are very helpful for the recovery of these athletes. It's not really about performance. It's about recovery. And these athletes are putting everything on the line, playing dangerous sports, beating up their bodies, training in very difficult capacities. And I really believe, I don't think it's fair then that they're limited, that they can't have access to all these tools, which will just help them heal faster, recover better, and live longer lives. For example, the biggest sport in America is obviously football, the NFL, which is American football. Well, the average contract of an NFL player is less than 3 years, but the average age of death is 58 years old, which is almost 20 years shorter than the average lifespan of other males in this country. They have way more concussions, traumatic brain injuries, CTE, complications of beating themselves up, yet they aren't allowed to use the tools that someone else is. I don't think that's right. I think we need to move beyond that. It's time to move way beyond that, kind of open it up, still have, guidance, but I think it's almost not fair to these guys. They're really, at the end of the day, they're making a living. They're sacrificing for their family, and it's entertainment. People love sports, paying money for sports, all these kinds of things. all of it doesn't add up to me. So all that being said, we can craft individual protocols with people knowing, okay, here's the boundaries of the sport, whatever, level it is. Here's safety. Here's the goals, whether we're working on recovery, whether we're working on endurance, whether we're working on strength, becoming more lean, and then combine different IVs, peptides, nutrients in a very safe way so that people can get the most out of them, for sure.
The key thing is, I think there is that they can use it off season, but they can get ahead of the game and during the off season, and back into it, and removal of all the peptides in due course. Yeah.
I mean, I think people can get creative as well. I don't know if the organizations like WADA are actually testing for all this stuff, but it's a big deterrent. If you get popped for a positive test, it's going to affect your career. It's going to affect a lot of things going forward. So a lot of guys will just steer clear. They just don't want to be a part of it, and that's fine. But again, they're not able to recover as easily. I mean, they're putting their bodies through utter turmoil, all kinds of sports, very challenging.
Absolutely. Yeah, I've noticed small amounts. We do have ambassadors at our clinic, and one's a UFC fighter, and really like the highest performance that you want to be at, you want to be utilizing so many of these top things to actually get you to your best performance, but they're not able to. And it's so frustrating that they can't access it unless it's approved and used and nothing's supported within the clubs. And, then you're just pushing something towards them and you're just really not touching the surface of what they actually need. They're working harder than any other human on the planet. So they need way more. Yeah.
Well, and also they say that they want to level the playing field, but some of these athletes have private planes and they have private chefs, and that's a performance enhancing component too, right? So that's and I know for a fact a lot of the most elite athletes that everyone knows about are never being tested. I mean, I know this for a fact. So it's not a level playing field, right? And so to use that as kind of the sentiment that we want to, make everyone equal is not true. It's false. And so that's why it doesn't add up. Yeah,
absolutely. So Craig, with availability to your, so the fast IV obviously is something that you can do within your clinic. Is there, obviously people can do that somewhere with nurses that are available in other states or in other countries. So where are all these available at the moment for people?
Yeah, we have a wholesale part of our practice where we train other practices, and then those practices can purchase things from us, and we guide them and train them on education protocols. Mostly, it's here in the States for the most part, although we do have a clinic open in London, a kind of a separate entity. We're open in London, expanding there, and really want to kind of reach head east with everything we're doing, because I think it's really an exciting opportunity. But yeah, I mean, people come to our office, they fly to our office most every week to engage in some forms of these therapies. We just opened up, as you mentioned earlier, this comprehensive telemedicine peptide platform. So it will allow people in a meaningful way to become a part of our practice, and then use peptides really all over the country. We're excited about that because, again, we've talked a lot about how safe peptides are, how effective. And so mostly it's people either coming to our practice or we work through this telemedicine platform for peptides. Other ways is, on our website, we have practices that we work with. It's a network of about 250 practices that we work with that, we help and shape and guide. Yeah.
Incredible. Yeah. Congratulations on London. That's very exciting. I saw that.
Yeah. It's amazing to operate in London. Yeah. We were just there a couple of weeks ago and very excited about all that.
Beautiful. I lived in London for some time, so it's like almost like home to me. I do.
Oh, wow.
Yeah.
We love London. Yeah. Such a special city.
It is. It really is. So that's really fantastic, and I think I just wanted to add there that it's such a fantastic way to get a trustworthy source of this sort of stuff, because a lot of people don't know where to source it from, and I think the hard yards are being done by you, by your team, and it really means that people know what they're getting, and that I think is key, and that's really important for the trust and people making those big changes moving forward. Yeah,
I agree. Yeah, no, we pride ourselves on that. We want to make sure that we were not taking shortcuts, that we're really going to be true to the potency, stability, the value of what we're bringing forth. It's very important to us.
Yeah, absolutely. So, Craig, I have one last thing, or three more things I'll ask you. So I want to ask what you, and we always do this at the end of our podcast, and I think it's a nice way to finish, and then we can sort of ask you where to find you and everything about the company. But three things that you do or you recommend others that will enable them or you to live smarter, not harder.
It's a good question. I think one of the most profound things that I've started doing in the last few years is infrared sauna. My wife and I do that pretty much every night, and that I wasn't expecting that to be as profound, but the kind of cleansing effect, kind of purification from doing that, challenging oneself, has just been a total game changer for both of us. Like it's the best purchase we've ever made for sure. So I think going back to what I said earlier, living smarter, not harder comes from not staying on the sidelines. It's having, it's interacting in things that you're curious about. And so the best way to stay youthful is to be curious and to be a really active participant in your curiosity only comes about through trying things. Right. Like you can read so many articles, you can listen to so many podcasts, but until you actually try something, you're not going to know. And that knowing, that kind of activity of knowing comes from exploration is really based in curiosity. And I think that's what keeps us youthful, that keeps us kind of bright. And that's how we keep making progress. So I'd say that's number two. And then number three, I say it a lot, but I go back to, using NAD in some fashion, right? Whether it doesn't have to be IV, you could do sublingual, you could do nasal spray, you can inject it sub-Q. NAD is so profound for so many people, myself included, that it's the one therapy that I always go back to as making them, helping protect the mitochondria, helping make energy. We need energy to do everything from healing to thinking to moving our fingers. Like as we get older, we just, we don't make as much energy. So that to me stands out. It would be the third thing. Yeah.
And I really do love number two because it's the curiosity that we have that does keep us lively and young. And you have to experiment. If you're not trying new things, then you're not moving forward and challenging yourself and actually growing as a person as well. So yeah, it's a beautiful thing. I think that's very well said.
Yep. I agree completely with you. Yeah.
So Craig, where can everyone find you? Let's just throw some websites and social channels out there.
Yeah, our website is koniverwellness.com. So one word, Koniver wellness.com. And then, we're primarily on Instagram. That's the place. And it's at Koniver Wellness. We'll be changing that, ramping that up. But those two places. Our website's about to be revamped. We're excited about that. A lot's coming, certainly the start of 2024, a lot of new therapies, new protocols, new approach. We have a whole modular health system we're going to introduce, which is based on this choose your own adventure kind of theme. Again, promoting the sovereignty, empowerment, and exploration, keeping it light, keeping it fun, and letting, each person kind of guide their own journey. That's what it's about.
Yeah. Beautiful. Yeah, I'm very, very much looking forward to having a look at all of that and following along and being in contact and hopefully seeing you in person soon.
Absolutely. Well, thank you so much for having me, Jodi. It's really been an honor to be here and talk to you for sure. I love it. And I love all you're doing. So please keep it up.
Thank you very much. And honor is all mine. All right. Thanks so much, Craig.
Thank you for joining us on another episode of Smarter Not Harder podcast. What an incredible journey through the world of performance and preventative medicine. If you found today's conversation as fascinating as I did, please take a moment to leave us a 5-star review on your favorite podcast platform. Your support means the world to us, and it helps us reach more curious minds like yours. We hope this episode has left you inspired and equipped with valuable insights. As we close this chapter, remember that knowledge is power, and we're committed to providing you with that 1-cent solution to those $64,000 questions. Stay curious, keep learning, and we'll be back soon with more insightful episodes. Thanks for being a part of our Smarter Not Harder community.